David Chadwick. I'm the Chief Officer of Romney Marsh Day Centre. And at the end of this first period of running the RAISE trial, which you've seen on this YouTube channel, I wanted to give you a brief summary of how we think we've done. Steering group have come together, and we're a cross-party steering group from the public, private and voluntary sector. There's about 10 members in total, and we meet on a regular basis with our project manager to try and work out how we can best develop some of the services and the protocols that make the trial possible. The trial's now been running for a month, and we've had some excellent results which you can see on the YouTube video clips if you click on them. We've mocked up everything, and you'll know from looking at the video clips that we've been using this piece of equipment. And this is just a standard commercial video conferencing suite that we have been loaned from a company called WorkSmart. It's an excellent piece of equipment, and it allows us to use very, very high definition pictures over the internet to be able to teleconference with our GP. You can see there is the camera, and that's the screen, and it's proved extremely effective. Now, why first of all have video teleconferencing? That really was because of feedback. Many of the older people that we talk to, and at this centre we work primarily with people who are anywhere over 50 years old, but primarily on this trial we've got a number of people in their 70s and 80s, and one lady who's even near 90. And face-to-face contact for that generation was considered to be something that was extremely important. We had the comment, well, you know, you do telephone triage at the moment as GPs, but we'd like to see face-to-face. We'd like to be able to talk on a face-to-face level, so we've made that happen with this trial. And we put protocols in place, so we have people's permissions, and we make sure that everybody involved in the trial is fully briefed about what they're doing. You'll also see on the videos a second set that we've released of videos from this week. And that's where we've been taking medical readings. So we do blood pressure, we do blood oxygen, we do blood glucose, we do weight, height. And the reason again for those is because it was felt that if for people with longer term conditions, and for many older people they may be working with 2 or 3 longer term conditions, if they can monitor, and we can help them to monitor in between meeting the GP, then it gives people a better understanding of how their condition progresses and develops, and how they maybe can manage their own condition a little better. We've had an app built for us by a company called IC24. They've built it for the purposes of this trial, and what it does is it captures that data on a graphical form and then transmits that data through and synchronises with the online GP system so that it can go into the permanent patient record. The steering group has been excellent, and we've worked with our clinical commissioning group, we've worked with a number of voluntary sector charities which I'll mention in a moment, and we've worked with members, as I said, a couple of commercial companies I've mentioned. We've also worked with Kent County Council Social Services to start to get a real overview of what services we could be offering from centres like these. It's important to be able to use centres like this in the community. They are absolute community resources, and we want to make sure that they are used to the full, so they don't just offer social care services. We already offer, for example, meals, so people can meet here socially, they can do different activities, they can follow different classes. We do exercise classes for people, seated exercise classes. We also have links in this building with our intermediate care team who have offices upstairs. We're also from January going to be offering mobile ultrasound and orthopaedic services. We have a team who come in from the cardiac rehab team on a regular basis to do a clinic. So there's lots going on, but we believe that community resources like this need to be used to the full. And in winter especially, when people struggle to get out to their GP surgery, and in this area, which you won't get from the video clip, we live in a very, very remote area where the transport infrastructure is not good. The nearest place that you can go to a walk-in hospital centre is the Royal Victoria, which is in Folkestone, or the William Harvey Hospital in Ashford. Both of those are about 18 to 19 miles away, and many people say they can't afford to do that. Locally, people can come into this centre, they can meet friends, they can join classes, as I've said, maybe have lunch with their friends, dine together, and then meet the doctor of an afternoon. And we've been trialling the time slotted between 12 and 2 o'clock. And as I say, the results on the YouTube channel speak for themselves. So essentially what's going to happen next? Well, the trial's going on until May next year. It's a 6-month trial that we've been funded for. The next part of what we're trying to do is develop the monitoring in the community, because the other side of that, of the same technology that helps people to capture information across a video link, can also be used in the community to help people keep in touch with each other. And what I'd like, and what we're going to be offering people, a number of trial participants, is the chance to have an iPad provided by the trial, with the same app as I'm talking to you on at the moment, that allows people to video conference really clearly and speak to each other on a sort of virtual network. Like a sort of version, I suppose, of Facebook, but face-to-face, literally, across a camera. And we're going to be trialling that in January. We're going to carry on doing the medical monitoring and the GP teleconferencing. And again, we want people to get used to, that's the real heart of this project, we want people to get used to the internet. So we're also working with a training provider who's going to try and do some training from the ground upwards. Basically, how do you use the internet from the point where you get your iPad out of the box to being able to do maybe online shopping, banking, anything that normalises the internet. As those of you who use the internet a lot will know, you can't access many services now from gateways and public information unless you have access to the internet. It becomes increasingly difficult unless you fill in online application forms. We want to support people in a generation otherwise who may get lost in the system, people in their 80s and 90s, not to be frightened of this fabulous resource. The final part that I'll just tell you about quickly is that we are at the moment working on, I suppose, what you'd term the phrase scoping, looking at the whole spectrum of what a call centre or contact centre could be. And we believe a contact centre can do so much in this, to be able to reach out to people, make sure they're okay, make sure that the video links and so on are all being kept up to date and appointments are being made for people, and also to act as what I suppose has been termed to me as an information repository. So, for example, our information advice service that talks about benefit entitlements, helps people to navigate the sort of the care services around them, helps them to look at what's available to them in the community. We'll have that on an enhanced level, so that people will be able to ring into a centre like this and be able to get help, support, advice, and a friendly and consistent face that can point them in the right direction to services in the community, whether they be health or social care. Also telling maybe about new public information services that come out. We can help people to have a real clear understanding of where they can find information that might help them with longer term conditions. So there's lots going on. I'd really ask you, please, support this YouTube channel by subscribing to it. Have a look at our Facebook page, which is also Romney Marsh Day Centre, and we will gradually put links on our website. So anybody who wants to engage in the trial, at the moment we are using a particular doctor's surgery, and again, if you email us or phone us on our telephone number 01797 363 888 and ask for me, I'm David Chadwick, the manager or chief officer, or our project officer, a gentleman called Mike Deal. They will be able to help you very clearly, or we will be able to help you, sorry, to get information about how you can participate in the trial. If you're a service or you're a service provider, again, we want to hear from you. We want to know whether we can work with you and whether you would be happy to work with us to make this trial all the better. If the services that you want to trial in the community, maybe we could act as what they call a test bed, an area where we can try new ideas. We are a charity. We are not for profit, and all of that I've just said to you is not about making profit. It's about making a service better for local people. It's about a service that local people can be involved with and maybe support each other in. And next year I'll be talking, as we develop our call centre, about ways that local people might be employed to help support and staff that initiative. If you like what you've heard and you'd like to know about how possibly you could work with us towards financing some of what we're doing, again, we'd love to talk to you. We're not trying to work independently at the moment. We are working on very generous support from Raise Challenge, but of course we need to find sustainable routes to make what we're doing work for the next year, 5 years, 10 years, and we'd love to work with other partners to see how we can do that in the fairest and honest and straightforward way possible. So, lots of food for thought. Most of all, I'd like to say we're coming up, as I'm doing this now, to Christmas, and it's a time many older people will face loneliness, maybe also feeling ill at the time as well. We really want, the core of what we're trying to do with this project is make sure that maybe by next Christmas, people on the Romney Marsh, older people who are isolated and vulnerable, have circles of support around them 24/7 if we can arrange it. But certainly circles of support from family who may be spread across the country. It could be from professionals from social care and healthcare and the voluntary sector. There's so much out there that many people don't even know they can access. We want to help that. And finally, we want to be able to connect people who can speak to maybe friends who they will have met through this trial online, as I'm doing to you, and be able to have really meaningful dialogue and not feel so isolated. One final thought. I have people come into this centre who say, I've not spoken to people for days. That worries me in the 21st century and in an age where the internet can work to eradicate that completely. So I'm asking if you know of any way you want to help us, whether you want to participate in a trial, whether you want to work with us because you're developing a service, whether you're a funder looking to help fund what we're doing, please contact me. My email address is david.chadwick@rmdc, that's Romney Marsh Day Centre, rmdc.org.uk. And together, I hope that by next year, there'll be a lot of people watching online who will be able to say to you, thank you for your support.